Not a great programme for you so far, because there is a sense of sympathy with the nurses, but also a sense that there is a limit to what the government can do to help. And the Prime Minister himself yesterday said, simply cannot meet your demand. Deep down, you don't want to go on strike either, do you?
No, I'm actually against the strike. So I think at $9 billion it would cost to meet this pay rise demand of 17.6%. I think that's unreasonable, and I do think a strike would be very unsafe for patients. The British Medical Journal has already shown that when there are less nurses on shift, the mortality rate rises. A study in the US showed that there was a 19% rise in mortality when the nurses went on strike over there. So I think that shows that I cannot see how they can meet the NMC Code of Conduct, which is to preserve the safety of all patients and uphold the reputation of the profession. So even though I am a nurse and I do sympathise, I don't think it's the answer, and I don't think it's morally right.
Although you're also a writer and a commentator on these matters, as well as a nurse. Yeah. And we're looking at pictures now. If you're listening to us on the radio, we're looking at pictures there of Rishi Sunak in a hospital, surrounded by nurses and other workers there. Mixed signals from government, because when the Royal College initially said we've balloted and these are the results, they also said, but we've met with the Health Secretary and the buzz was quite positive. That's now all gone very, very quiet. Does that worry you?
It does. It concerns me that they said Steve Barclay walked away from negotiating with them on the pay demand, but then I'm not sure what the government can do when they've already said that this is unreasonable. I think the amount that they're asking for is just so unreasonable that I can't see how negotiation is possible for the government and the RCN.
I wish you were at those talks, because actually you do answer your own question in a piece that I read that you wrote, and that is that you are convinced, as a frontline nurse, that there is fat that can be cut from the NHS, and a lot of it is to be found, as a lot of GB News and radio viewers and listeners have told me in a whole series of emails and tweets, and that is in middle management. They don't want it cut from you, because if I'm in trouble or my kids are in trouble, it's you and the doctor and the consultant who help me out.
Absolutely.
The middle manager, But you've looked at that from the front line and you say, yes, that can be done.
Oh, absolutely. There's a huge waste of money and mismanagement of funds in the NHS. And I mean, in NHS England, they had a load of laptops that they threw away after a couple of years of having them. They bought them all in bulk in the pandemic, and then they had to dispose of them within 2 years, saying they were old. I mean, that's a waste of money. But then, as you say, there's middle management as well. I mean, there's such a waste on middle management, and there's such mismanagement of the whole system. I think they need an overhaul of the whole structure of how the NHS is managed. I think there's a lot of unnecessary managers in place when that money could be saved, and then maybe it would be more reasonable to then ask for a pay rise for the nurses. But we can't just keep giving more and more money to the NHS.
No. Well, you're so honest about it, because I do genuinely find that quite extraordinary. Because the debate within the rail industry is exactly that both the government, new Transport Secretary, and the train operating companies and Network Rail themselves are saying to the unions, like it or not, if you agree to these changes in work practices and so on, then there will be money.
Yeah.
In effect, you're sitting there as a nurse saying, let's look at what those changes in work practices and how the NHS works might be made. And then, lo and behold, you know what? You might actually find the money that we want.
That's right, exactly. And whereas at the moment, to ask the taxpayers to spend $9 billion on a pay rise for nurses when they haven't done anything to actually save money in the NHS, with all of these areas that could easily be improved upon, I think that's what I find so unreasonable about the whole situation. And then a strike, if it wasn't a cost of living crisis and we weren't in a deep recession, then maybe it would be more reasonable if they made a reasonable demand and it wasn't being met and there was the money there. But at the moment, the situation just doesn't allow for that. It's not possible to get that pay rise.
Sure.